سلايد 70.
Alright, Bismillahirrahmanirrahim. So don't worry if you need a special lecture, I will arrange online. There is no problem, but because we have problem with the dean, he always tells that you have to take the lecture in the first week. Anyway, so the last lecture, it was very simple things. If you go through them, plus I will send you the tutorial like I sent for the kidney, you remember?
Yes.
Don't worry, inshallah. And he will give you the record. So we basically discussed the transport across the cell membrane, the difference between intracellular fluid, extracellular fluid, what is action potential, and basically it was revision of the basic things which we learned in the first semester. So today we move on gradually. Our target is to cover up to muscle, inshallah, and we'll go slow. We have 4 lectures left for this unit, and then we have maybe 4 or 6 lectures for the nervous system, motor system, which I'll be taking with you after that. Alright, so do we remember from first semester what is synapse?
ناقل عصبي.
These receptors?
Okay. Synapse has some receptors, agree. But what is synapse? How do we define a synapse? How do we define a synapse? What is a synapse? So everything is allowed except for WhatsApp, okay? So just see your slide and it's okay. So it is junction between 2 neurons. 1 neuron, 2 neuron. It is junction between 2 neurons. 1 neuron can send the message to the other neuron. So this is what synapse is. So synapse is junction between 2 neurons. What is the name of first neuron? The name is presynaptic neuron. What is the name of second neuron? It is postsynaptic neuron. Pre means come and post means by. So this is presynaptic or postsynaptic neuron. In between the 2 neurons we have got a small gap which is called synaptic cleft. This is the name written over here. If you remember last time also I told you the figures are important. We give questions from the figures as well. But I will give this description on the next slide as well. Now what happens is this, that when an action potential, it is coming in the presynaptic neuron, yani it is traveling like this. When it reaches here, the calcium channel open. The calcium goes in and this green thing we call neurotransmitter. So neurotransmitter, it is released. When neurotransmitter is released, this is the second neuron. Here are the receptors. So it binds with the receptor and it opens the channel for sodium, or it can open the channel for chloride. You sit there, please. Yes. Because he will make you laugh. Because he is mashallah laughing boy. He will make you laugh. Alright. So these steps I have put it on the next slide. What is a synapse? Junction between 2 neurons. It is junction between 2 neurons. What are the parts of synapse? Presynaptic neuron, and then we have got the postsynaptic neuron, and in between them is a space which is called synaptic cleft. Okay, and the presynaptic terminal, it ends in a slight swelling which is called synaptic knob. And this contains the neurotransmitters. I go back. I have explained this over here. This is presynaptic neuron. This is postsynaptic neuron, the brown one. The place where they join, there is a small gap. This is called synaptic cleft. The presynaptic neuron has got a neurotransmitter in it. Now, who will name some neurotransmitter? Any neurotransmitter that you know. What is the meaning of neurotransmitter? Think on it.
That's
Neuro,
it's got sent
yeah,
by.
it is something related to nerves.
Yes.
Transmitter or transmission. What is transmission?
ناقلات.
تقع.
Yani, ittasal, you know, it is just transferring something from one place to the other place. What is neurotransmitter? It is a chemical which transfers the impulse from one neuron to the next neuron. So we start once again. What are the steps of synaptic transmission? I discussed it with you. This is now third time that I am discussing with you. So the action potential, it reaches the presynaptic neuron. The calcium, it enters the presynaptic neuron. The neurotransmitter is released into the synaptic cleft. The neurotransmitter, it passes through the synaptic cleft, it binds with the receptor, and what happens next? There is change in the postsynaptic neuron. Why there is change in the postsynaptic neuron? Because there is entry of sodium. So neurotransmitter, what happens to neurotransmitter after that? Number one, it is broken down. Some enzyme, it breaks it down. Or it is taken back. Or it is diffused. I go back once again for the last time. And now I can go fast because all of you are here, mashallah, almost. A nerve impulse in a nerve comes in the presynaptic neuron. Calcium enters. Neurotransmitter is released. It binds with the receptor on the postsynaptic neuron. This causes opening of the ion channel, which leads to change in the membrane potential, which is this one, change in the postsynaptic neuron potential. So this was about the general discussion of synapse. And we have two types of synapse. One is chemical synapse and the other is electrical synapse. We do not have many electrical synapse in the humans, but in some of the animals we have got many electrical synapses. The type of synapse which I discussed with you is chemical synapse. Now, why I left the last line, I am going back now. The chemical synapse is this one which I have discussed with you, because it is using a chemical which is called neurotransmitter. So synapses, they operate only in one direction. That is from presynaptic neuron to the postsynaptic neuron. They cannot go in the reverse. But in case of electrical synapse, it is just two neurons which are bound together, and the current can go from one side to the other side in any direction. But these are less in humans. They are more in the fish, like the electric fish, the fish which give current. Chemical synapse is our main topic. Chemical synapse can be excitatory and synaptic. See, what is excitation? What is excitation? Excitation means stimulation. For example, please don't mind, okay? I tell him, start moving your hand like this. You see, and he starts moving this hand by my command. So this is excitation. And he is moving his leg and I tell him, stop moving your leg. What will be the name? Inhibition. Alright? So we can have excitatory synapses and we can have inhibitory synapses. Can you give me some example of inhibition? Excitation is very easy. I order my hand to move or to write. Yes?
When the stomach is full of food, your other systems calm down.
You see, what he's saying is this, that when your stomach is full, all the blood, it starts going towards stomach for the digestion to increase. So many systems, they get inhibited, and we go for calula, after our food, and he's already trying to sleep. So the simplest example is sleep.
Oh.
Simplest example is sleep. You are attending my lecture. I am not delivering good lecture, or I am just going in one direction. Automatically you will go into inhibition.
Right.
And what will be excitation? Wake up. I wake you up. It will be excitation. So this is.
I listen file to my iPad.
Okay. So this is excitation. That is, I tell you, get up. Automatic, you are sleeping. Can you stop your breathing? Please, see, I requested not to use WhatsApp. Hide it. Teacher can see from here. Just, if on this, no problem. Teacher can see this. Don't worry. When you will become teacher, you will understand this. When a student is lost, we know he's doing something else. Don't worry. Yeah, I have 33 years of experience of teaching.
Allah Ta'ala come back.
May Allah bless you. So we have made a very simple concept, excitation and inhibition. Now we go to our first semester and we recall one thing. That is action potential. And in action potential there is depolarization and there is repolarization. What is depolarization? Sodium goes in. Why do we cause depolarization? So that there is excitation. Inhibition, we bring out potassium. So when potassium goes out, because it has got positive charge, the cell membrane, it becomes more negative. So this is actually the process of inhibition. Now we will not waste much time, we will just discuss this process in a very simple way. If a synapse is excitatory, the first synapse, it will make a potential in the next neuron. The first neuron, it will make a potential in the second neuron, which is called
Post-synaptic.
excitatory post-synaptic potential. Yani, first neuron, it sent the neurotransmitter which made the second neuron active or excited. I will not stop here, I'll come back to this. First we see this. Now what is the name?
Inhibitor.
Inhibitory post-synaptic potential. Yani, the first neuron, it made the second neuron inhibited. I will say, make a just example, it's not effect. This hand is moving. And this hand, it comes and it holds it. Now this has stopped moving. Yani this was inhibited. You see? So first neuron, it gives a neurotransmitter which goes and binds with the second one and we stop breathing. Or we sleep. Or like he said that many systems, they go down when our stomach is full. So there are two types of potential. One, if there is excitation in the second neuron, this is called excitatory postsynaptic potential. Can you give example of some neurotransmitters which are excitatory? Now this is a short answer question and this is MCQ. Glutamate, aspartate. Keep this in your mind, okay? Especially female side, they like to give this type of questions of memory. So we have to accommodate it. Can you give some example of a neurotransmitter which is just inhibitory? So the commonest example is GABA. Gamma aminobutyric acid. No need to go for the long name. Now what we will do is this, that we will give MCQ that which one of the following is inhibitory neurotransmitter? Listen, histamine, noradrenaline, glutamate, GABA. GABA.
Inhibitory GABA.
See? Likewise, we will reverse all this and we will say which one is pure excitatory neurotransmitter. Histamine, noradrenaline, glutamate and GABA. Okay, so just from this prepare these two questions. Now, if Saleh has brought a marker, I think his pocket has got a marker.
The
Today
black
forgot it.
one.
Okay, no problem.
I don't know.
No problem. Okay, if there is +2, -2, how much it will be?
0.
0. If you make jama between them. Okay, if there is +1 and another plus, thank you, was now done. Jazakallah khair.
Yeah.
If there is +1, another +1, another +1, what will be the result? 3. What am I saying? I am saying if there is one-time stimulation of a neuron which sends a neurotransmitter, or it sends 1, 2, 3 times action potential, the result will be
More.
increased. Okay, this one is sending excitation, and there is another neuron which is sending inhibition. So +1, -1. Result is 0. This I will show you in the next. Sometimes when we have to make something like this, yani, I touch this, this is having current. What will happen? Reflex. Huh?
Yes.
If I am a girl, what will happen?
Scream.
Yes. Ah! You see?
Yes, something like that.
Something like this.
Yeah.
He said scream, so I made maybe crying. You know? So yani, one single stimulus here diverge to many neurons and make the stimulus big. You understand? And your teacher is telling you when you were young, in Thanviya or even before, concentrate on what I am saying.
Right.
Listen to what I am saying. And you were also trying when you were just before your exam or quiz to concentrate. And ting, message comes, WhatsApp. Ting, something else happens. You are trying to concentrate, you do not even listen to this. You understand? So many neurons, they are converging on this page where you are learning what is a synapse. So these 3-4 messages now we'll do on the next maybe 4 or 5 slides. Starting once again, we have got excitation and we have got inhibition. We can have excitatory postsynaptic potential and we can have inhibitory postsynaptic potential. Now, all depend upon the neurotransmitter, which is a chemical messenger. I have discussed it with you. It is released and made in the presynaptic neuron. There are 2 types of neurotransmitters. Without seeing the slide, can you tell me what are the 2 types of neurotransmitters? No, that is synapse. Synapse is chemical and electrical. I start once again.
The inhibitory.
Very good. Without seeing the slide.
Yeah.
So they can be inhibitory or they can be excitatory. Alright? Then I touched something and I got increased heart rate, increased blood pressure, I screamed, I cried. I am exaggerating, but this is reaction of pain to all of us.
Yes.
You know, if you don't trust me, when you are playing football and someone hits the football and it hits you here, you know,
Doctor,
what happens? Exactly the same story.
I'll cut this.
You got the idea?
Yes.
No, it's okay. The teacher is teaching, you know.
Yeah.
I will not say anything bad.
No, it's not
Just
perfect.
to make you understand that divergent pathway, one synapse stimulated 1, 2, 3, and the 3 stimulated so many. So all the body was involved. This is called flight-fright response. Yani, can you believe that I just see a snake here and my blood pressure goes up and my hair stand, you know, and my heart rate increases. And if I am a girl, I'll scream and cry.
Yes,
You understand what I'm saying?
I understand.
Second one. 1, 2, 3, 4, 5, 6, 7, 8. Don't mind, okay? He's sleeping. And he's in deep sleep. I say Muhammad. No effect. Muhammad. Now 1, 2, 3, all of us will together say Muhammad. Now the sound is so much that he wakes up. You understand? And there is another method which will be after a few slides. I am waking in Muhammad. Yeah, Muhammad, get up. And he is not getting up. And he is his friend. He punches him, you know. Big stimulus can also get the same effect. So multiple stimuli, multiple neurons converge, you know, on a marcus. 1, 2, 3, and then they converge on 1. So this is convergence and divergence. Yani, the postsynaptic cell take information from many neurons, or divergence. Yani, one presynaptic gives information to many neurons. So I gave you examples so that we understand this. +1, -1. 0. +2 -1 is equal to +1. +1 -1 0. Sahi?
Sahih.
+1 +1 +1, very powerful. 3. If you stimulate Muhammad, no effect, because it is not reaching
Threshold.
Threshold.
threshold. Muhammad, not reaching threshold. Now, 2 or 3 of us said, Muhammad, it reached threshold. There is action potential. Jama, spatial summation. You understand what I am saying? This is 1, 2, 3, 4 people. Or single person gave a big stimulus, reached threshold. Alright? A single neuron can repeatedly fire. Do not be worried. You know why we are teaching it? This we do not teach to medical students. This we do not teach to pharmacy students. Just in a few months, maybe you have already started it or you will start it after a little while. You will learn how to stimulate the nerves in an area which has lost its nerve supply. Someone has broken the back. Spinal cord is broken in the accident, bike or something like that. No sensation in the legs. What will happen to the muscles?
Weakness.
Contraction.
The muscles, they will not be functioning, number one. Motor activity will finish. Sensory system, no sensation. But then the muscles, they will start, they said weakness, atrophy. You want to keep this person as much healthy as possible. Is his nerve there?
No.
Yes, nerve is there. It is just disconnected from the brain. Cut from here. The link from the brain, yani, I cannot move my leg, but you can move my leg. How? By giving the electric stimulus.
How I can give them this?
This is, they will teach you. This is not my job. But simply, we just put the electrodes on the neuron near the place where it is cut. And the action potential can go in the nerve. When action potential goes in the nerve, there is twitching. There is muscle contraction. If the muscle contracts, it's like I am going to the gym and I am exercising. So my muscles, they keep healthy. That is why I walk in the morning or you go to the gym. You understand? So this is the reason that we are discussing these topics with you. They will be used later on. So this is exactly the same thing that I told you. 1 plus, 1 minus, no result. But 2, yani plus 1, this makes a big action potential. So the thing which I said is now written here, except for plus 1, minus 1. If excitatory potential is equal to inhibitory potential, no action potential. If excitatory potential is more than inhibitory potential, excitation. If excitatory potential is less than inhibitory potential, inhibition. If excitatory potentials are multiple, there is powerful excitation. We three together said Muhammad. Or I said it very loud. This is what it means. We have got a grand potential. So I am now writing the same thing for you to, you see, you cannot do MCQ over here, you see. So these two topics, temporal summation, spatial summation. Summation means to make jama, to add something. There are two types, temporal summation and spatial summation. So what is temporal summation? Several stimulations at the same neuron of the synapse. It is repetitive stimulation from a single neuron multiple times. Muhammad, Muhammad, Muhammad. You understand? Or we say together, what will be the name? Spatial summation. Alright? So this is, let's read the first line. It comes from different presynaptic neurons. And it could be excitatory or inhibitory. Diagram, this one. It comes from different neurons. It can be both plus and reaction. It can be 1 plus other negative, 0, no effect. Spatial summation. Temporal summation comes from single neuron, repeated stimulation, which add together to reach the threshold and give you the result. My dears, can this go permanently? I am just doing my finger like this, like I am firing a gun. Can I do it indefinitely?
If you don't get tired, yes.
So why did you say you don't get tired? Then say you will ultimately get tired. There is no one amongst us who never gets tired. Even Messi or Ronaldo, they are playing football match and the match is 1-1 and 10 minutes are left. And you see the coach, he calls the best player out and says, sit there. Why?
Tired.
Because he knows that he might help in winning this match. But then next 10 matches he will be, useless. What is the word? Fatigue. What is the reason? There are multiple reasons. What happens to you when you play football match and you run and run and run and in the end you are running very fast? It's before sleep.
Eat.
When you come out, eat, very good. When you come out, you are, what is this?
Collecting.
Wonderful. You have produced lactic acid because you are going into anaerobic metabolism. And why do you see football players eating banana or drinking Gatorade? What is the name? Gatorade? Gatorade. He says potassium. Tamar. Banana is the most favorite.
Calcium from
Yes. Potassium. Why do you want potassium? Why do you want sodium?
Action potential.
It depends upon that. And he's saying calcium for a reason. I will reach there in the second lecture now, inshallah, today. So, electrolyte disbalance, fatigue. The first thing which I said, and he said lactic acid, this means I need oxygen. So, when oxygen is less, I go into anaerobic metabolism, fatigue. When potassium from the cells come out, this is abnormal, fatigue. When sodium from outside go in the cell, abnormal, fatigue. But yes, today's topic is not this, electrolytes or this. Today's topic is this. What is written here? What is the cause of fatigue?
Overstimulate.
Read it. Depletion means less.
Depletion. Okay.
What is today's topic? Neurotransmitter. So neurotransmitter is formed in the presynaptic neuron. It can finish. It can finish. So simply you see Ronaldo going like this. His muscles are stiff. And why is he better athlete than me? Because I do not practice. So with practice you increase your level of fitness or endurance. What is endurance? Define endurance.
Ability to repeat.
What is endurance?
Ability for repetition.
Who is going to gym? Anyone? You see? What is fitness? What is endurance? He can perform better than his friend of same age, same weight, same background, maybe his twin who is not exercising. In the same given time, he can lift more weight, for example, if he is doing this, or he can cycle more, or he can swim more, or he can stay underwater more. Are you understanding what I am saying? Yeah. This is endurance. This is endurance. So, all right. So fatigue, neurotransmitter is finished. Now you know all the causes for fatigue, okay? But one of them was today, that is decrease in the neurotransmitter. Now we have many medicines that can act on the synapse. If you recall the synapse, we had calcium going into the presynaptic neuron, we had neurotransmitter coming out and binding with the receptor. We had an enzyme which removes the neurotransmitter and by breaking it, we had sodium which enters into the second synapse through the receptor channel. We have potassium which comes out. So calcium, sodium, potassium, so many things. We can block calcium. If we block calcium, it will not enter into presynaptic neuron. The presynaptic neuron will not function. The synapse will fail. We can block the neurotransmitter. We can destroy the neurotransmitter. But why should we do it? I will give two quick examples, and one large example is after the muscle. That is myasthenia gravis. Keep this in mind. One quick example is this, that Allah subhanahu wa ta'ala has made serotonin in our brain. Serotonin, it is a neurotransmitter. Dopamine in our brain. Acetylcholine in our brain. Noradrenaline in our brain. I'm just talking of brain. So these four are main. You all know about dopamine. Do you know?
Yes.
If dopamine is less, what is the name of the disease?
Boredom? What? Oh, this.
Rasha, yani what is it? Parkinsonism. Parkinson's disease, you see? Rasha. The person cannot make stable. Dopamine. So we can give him dopamine, neurotransmitter. And this person is depressed. You know why? Serotonin is less. So we can give him serotonin, but how to give him? If we give him serotonin by mouth, the stomach will digest it. If we give him by injection, the enzyme will finish it.
By muscle.
So we do not give serotonin. We give something which increases the serotonin in the synaptic cleft. So we call them serotonin receptor reuptake inhibitor. Don't worry, this is for pharmacy people. Our discussion is just this, that we increase the level of serotonin. Listen, I have got high blood pressure and my high blood pressure is not being controlled. So one of the method is this, that you give me beta blocker medicine. What is beta blocker medicine? Don't worry, this is just for understanding. I said examples. The beta blocker medicine is this, that you block the receptor for adrenaline or noradrenaline, which is increasing my blood pressure. You see? So I am just covering 3 or 4 points here. We have many medicines which can affect the synapse. We have medicine which blocks the calcium channel. Synapse will not function. We have medicine that block the neurotransmitter receptor. The synapse will not function. Or we have drugs that block the conduction of action potential by presynaptic inhibition. So different types of drugs, they act on the synapse and they help us regulate different types of diseases. Enough for this topic. We are shifting to skeletal muscle. Saleh, what is the time? Or you can tell? 40?
Yes.
40. I will continue and we will finish up inshallah. Okay?
Okay.
We won't take break. Otherwise, we take break and come back and the story gets long. Inshallah, finish one go.
Yes. Sure.
Now, we have two excitable tissues in the body. Two excitable tissues in the body. You see, you will be surprised what I am saying. Skin is not excitable tissue. Our excitable tissues are either nerve or the muscle. And the muscles are 3 types. Skeletal muscle, smooth muscle, cardiac muscle. So technically only nerve and muscle, they are the excitable tissues. So we'll just take up these things at a little higher level now. These are your main topics in physical therapy. How much do we know about skeletal muscle? What is skeletal muscle made up of? How does skeletal muscle look like when we cut an animal and we bring the meat? What is this, what we eat, lamb. So these are all muscles, These are all muscles. So what does it look like? What is it made up of? What is the difference between my big muscle and my small muscles? Or even the ones in the bobo, which makes it big and small, pupil. What is actin and myosin? Remember?
Yeah.
What is actin and myosin? How do actin and myosin, they join with each other? What is troponin? What is tropomyosin? Why my muscle is not contracted all the time? How my muscle relaxes? I am talking of just skeletal muscle, not smooth muscle, not cardiac muscle. Alright? Because our body, most of it is skeletal muscle. Maximum part of our body is skeletal muscle. You see? So we just discuss it, and physical therapy is mainly control of the skeletal muscle. So you must have clear idea about the function of skeletal muscle. How the message from the nerve come to skeletal muscle. This is the last, and this will be the last part of our lecture. What will happen if the message from the nerve does not reach the muscle? What is the name of the disease? How can we treat this patient in whom the message from the nerve is not reaching to the muscle? So these points we will cover. What electrolytes are required? What is the role of calcium in muscle contraction? Okay. So these are the questions which we are trying to answer in the next about 20 slides. So the skeletal muscle is an excitable tissue. Muscle's function is contraction. Now please look at the slide with me, and then you can study it later on. And again, the description is on the next slide. So don't worry, although you have to prepare these slides, but the description is given in the next slide. So the muscle has got fibers. These are called muscle fibers. The fibers have a membrane around it, like any cell. You know, the membrane of the muscle is called sarcolemma. Sarcolemma. Don't worry, it is on the next slide. Don't worry. The smallest fiber is called myofibril. If you see the myofibrils in the microscope, you see light. When I teach this lecture, I wear this type of shirt. Purposely, you know.
Oh,
I have other plain shirts also. But for this lecture, I wear this.
smart.
You know. Say it in Arabic or in English. No problem. What is this pattern?
مخطط.
So isn't it the same?
Yes.
It is.
When we bring it out, one myofibril, again we look it into the microscope, same pattern is seen. Now let's see this my shirt. Can you see a dark line?
Yes.
Yani blue one?
Yes.
Can you see a light line? Yani white one? Agreed or not?
Yeah.
Yeah.
Sahi?
صحيح.
So we have got a dark and a light, a dark and a light, a dark. You understand?
Light.
What is dark band? What is light band? You know, we'll just keep on discussing it. So we take it to the magnification now. This was histology, nothing to do with physiology. We have got a big muscle. This muscle is made up of, you know, these big collection of the muscle fibers. Each muscle fiber has got sarcolemma, and it is made up of dark and light band like my shirt. Dark and light band. Dark and light band. Alright, what is this?
Fiber.
If we go into the microscopic level, now you will just remember these names, and then I will join it for MCQs.
Yeah.
Yes.
Leave the mobile, put it in the book.
The slides.
Okay, because you don't have attention. So when we look into the microscope, keep three things in the mind. One, I told you sarcolemma. What is it?
The membrane.
The membrane of the muscle. Now we come to the second thing. You see this green thing going like this. But it has got small bags on the lateral side. So these tubes, they are going transverse. What is transverse?
عرضي.
You know, this is longitudinal.
Yes.
This is transverse. Yani it goes, something goes cross.
Horizontal.
You understand? So these are called transverse tubules. And these are called lateral sacs. And these lateral sacs are part of the sarcoplasmic reticulum. What is endoplasmic reticulum? Remember?
Yes.
You heard the name. Don't worry. It was in the cell, you know. It packs the proteins which are formed, or packs the carbohydrates which are formed, or in my case, packs the neurotransmitter which are formed. It is same, anything related to muscle, it is called sarco.
Nothing related to
If it was membrane of the neuron, it will be called neurolema. But here it is called sarcolema. It is endoplasmic reticulum of the muscle, it is called sarcoplasmic reticulum. Nothing else, no difference. But for me, the main point is this. Listen, I will join these things in a minute, inshallah. Everything is on the slide. What is this?
muscle fiber.
Muscle fiber. These T tubules, they spread the action potential. These are not nerves, but their job is to spread the action potential in the muscle. You see, this one is small, deltoid. Probably this one is our biggest muscle,
Yes.
the gluteus muscle, the bigger one. These are 4. You will learn this in detail. This is your job, physical therapy. And then we have got a big one here, pectoralis muscle. You understand? How to spread action potential in this big muscle? So these tubes, they take the action potential. All right?
Yes.
Sac. What is sac?
Keys.
He's saying keys, I agree. Or shanta. Bag. In fact, we have got better word for Arabic for the big one, you know, which we put like this.
Yeah.
That is sac. What is the job of shanta or keys or sac? To keep something. Yani, can I touch it? Can I touch it? Bismillah. You know, I put everything into it.
Yes.
You understand?
Yeah.
So this is the function of the sac or the shanta or the bag. What is the function of endoplasmic reticulum lateral sacs? It stores calcium. Is it near the transverse tubule?
No.
Yes, it's near. See the red one.
The red one. No.
Yes. These are the lateral sacs. These are the lateral sacs. These are the lateral sacs. Listen, last point. And then we go to the description. When action potential passes from here, it causes release of calcium.
Okay.
And 10 times I will repeat the importance of calcium in muscle contraction, inshallah, in short while. Without calcium, no muscle contraction. More calcium, more power for contraction. Less calcium, weak contraction. Zero calcium, our muscle go into contraction like this. And they don't relax. Alright? So keep in your mind. What is the word?
Sarc.
Have I discussed this word with you?
Yes.
No, that was sarcolema.
Sarcolema for muscles. What is this for?
Yes, this is what I am saying. That is why I noted that. No, you didn't notice that I have discussed sarcolema here. So that is written here, sarcolema.
Yes.
Not sarcomere.
Okay, that's pathology.
Wonderful.
Huh?
Physiology.
Some people they are calling it, you see. So my dears, what is muscle contraction? I start from the other side. What is muscle contraction? Already he is saying, when you make the sarcomere short, this is called muscle contraction. What are you saying, doctor? Okay, so I give the example with the help of, in fact, this one. Thank you. Thank you. Now this is his and this is yours.
Okay.
Now this is like this. Can you see? So why I made this like this? Because I wanted to show you that this is myosin, this is myosin, and this is actin. All right?
Yeah.
So now I'll keep only one. So they are going like this. What is this? Z line.
Okay.
Z line. Okay?
Okay.
What is connected with the Z line?
Myosin.
Actin.
Actin.
What is connected with the Z line? Actin.
Actin.
And the actin filaments are like this. So from one Z line to the other Z line, it is called sarcomere. What is contraction? That it will slide and it will become short. What is relaxation? That it will slide and it will become big. What is contraction?
Small.
The sarcomere becomes big.
Small. Yes.
All right. So sarcomere is the distance between two Z lines. Thank you. I promised you that everything is written on the slide, okay?
Yes.
So up till here there were only diagrams. A plus students can pick up many points from here. No question will be out of the slides. But figures are part of the slides, okay? But everything is written here as well. So myofibril, it is a cylindrical bundle of contractile filaments within the skeletal muscle. It is made up of myofilaments which are thin and thick. The arrangement of thin and thick filament make the light and dark bands like Dr. Ahmed's shirt. This is called striated appearance, and you gave me the Arabic word. They are specialized for contraction. What? Myofibril. Who contracts? Myofibril. Who contracts? Myofibril. Through their ability to contract, muscle cells can shorten and develop tension. You know, I can do like this. I can lift it, and I can have hand wrestling with you, although he will win. Due to contraction of my myofibrils. If my muscle does not contract, you know, they will teach you in physical therapy isometric contraction, or they have already done it, and isotonic contraction, but it is contraction. You see, I am trying to lift it. Look at me. Look at me, look at me. I am trying to lift it. Is my muscle shortening? No.
No.
Can you see it shorten? No.
Low ta'ala.
But is the tone in my muscle changing? Yes.
Yes.
You understand? It's different. Here is 5 kg or 10 kg and I lift it. Can I lift it? Yes.
Yes.
Can you see my muscle shortening?
Yes.
Yes. You understand? So there is difference between isotonic and isometric. This is not my topic. This will be discussed by your teachers there. What is sarcolemma? The membrane of the muscle cell. Just description. What is sarcoplasmic reticulum? It is the endoplasmic reticulum of the muscle cell. ER means endoplasmic reticulum. It is interconnecting tubules surround each myofibril like the sleeve of a loosely knit sweater. Like one of our students by chance is wearing a typical sweater. So I'll take chance. This is sweater. This is sweater, okay?
Yes.
So these tubes, they are like these fibers which are going into one another. Thank you. You understand? I am lucky that he is wearing it because the word is there. It is like a loosely knit sweater. What I am talking about? The sarcoplasmic reticulum. Which figure I am discussing? This one. Sarcoplasmic reticulum. It is endoplasmic reticulum. What is the function of T-tubule?
Transfers.
Come on. T-tubule is transverse tubule that run throughout the muscle. They spread the action potential. MCQ, 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 MCQ. Alright?
Yes.
So this is detail of many slides. What is sarcomere? What is sarcomere?
Area between.
The area between two Z lines. the area between two Z lines, actin, myosin. See? Alright, so this was description of these 5 slides. We come to the thick filament first. Thick filament is myosin. Thick filament is myosin. Maybe someone out of you has seen the game which many people play and they call it a game. It is game of old people, golf.
Especially rich people.
Rich, old people. This is yes, otherwise what is in this game? Nothing. So it is like the golf bats. Okay? So this one we pick up. This, you see, I go back with a purpose. This is what we are discussing. Can you see the small things coming out of the line?
Yes.
These are this bat-like things. You know, we are discussing this, the red one. It is made up of 2 fibers, like the DNA there, down, here. Okay?
Yes.
You have seen the DNA. This is called tail. How many tails does it have? Thick filament? 2 tails. How many heads it have?
2.
What are the properties of the heads?
Catch.
Look at the diagram. What is special points about the head? Tell me 2 special points of the head of myosin.
Maybe it catches something.
Number 1, it has got actin binding site. Yani, remember actin?
Yes.
Yani it can bind with actin. What is binding? To join. Number 2, it has got ATPase site. Do you know the word ATP?
Yes.
What is it?
Energy.
Energy. What is it made up of? Adenosine plus 1 phosphate makes adenosine monophosphate, 2 phosphate adenosine diphosphate, 3 phosphate adenosine triphosphate. You break it with an enzyme which is called ATPase. To break it, ADP, 1 phosphate broken, a lot of energy released. 2 phosphate broken, AMP remaining behind, lot of energy broken. I played football, my temperature increased. You understand? So what are the 2 special things about the head? So listen, 2 tails, 2 heads. Head has 2 properties. It has got actin binding site and it has got ATPase activity. Now I will make a small demonstration and then I will go to the next slide and you wake up. Come here and you also come here. Yes. Carefully. I told you before. Leave it here. Sorry to confuse you. You see, please don't, they will not mind you, okay? Just to make you understand. This is Z line. And this is Z line. You understand?
Yes.
And now I push them a little here like this. Name this thing. What is this?
Actin.
Actin. Name this thing. Myosin. But now name this thing. Heads of the myosin. What is the function? It binds with this.
Get closer.
And
Yes.
this is contraction. You understand?
Yes.
Did I need energy to do this?
Yes.
Do I need ATP for this?
Yes.
Do I need ATPase for this?
Yes. To break.
So this I'll explain in 10 slides. This small process.
Good.
You understand what I mean? So 2 tails, 2 heads, and head has actin binding site. Like I got hold of their elbows. And number 2, head has to do this.
Yes. To control.
This is power stroke. You cannot do it without energy. So for energy, you have to break ATP. To break ATP, you need ATPase. So myosin ATPase site. Now inshallah you will not forget it. Everything is on the slide written, don't worry, for the exam. But for concept, you have made it. So thick filaments are made of myosin molecules which are bundled together like the golf bats. Myosin molecule has two head and two intertwined tails like the DNA. The head has ability to move back and forth like this. Thus it forms the cross bridge between thick and thin filament. Yani it can make jasr between Bahrain and Khobar. Yani between actin binding site and actin, which I will show you after a minute.
Why the head is moving?
Because otherwise there will be no contraction. You want to bring the two Z lines. Remember, these were the two Z lines. If I don't move, they will stand there, I will stand here. So I have to move like this to bring them closer. What is hinge? What is hinge?
One dimension.
Yes. Say the Arabic word. This is my hinge joint.
Yeah.
This is my ball joint. This you will learn in anatomy.
Ball and socket.
Physical therapy. Total. This is my hinge joint. It cannot move like this one. So the hinge portion of the linear tail allows vertical movement so that the cross bridge can bind. Hinge. Hinge. You understand? Hinge. That one. Exactly this one. The head has two binding sites. One for actin, and the other for ATP. The binding of ATP transfer energy to myosin cross bridge as ATP is hydrolyzed into ADP plus 1-phosphate. Yani it breaks ATP, releases energy, releases 1-phosphate, and the remaining is ADP. Why do we eat food?
Energy.
To make what? ATP. Wallahi, this is meat, and this is fat, and this is carbohydrate. We just use them to make our ATP. Where do we use them? Everywhere. But where is maximum use?
Muscle.
What is the muscle which is always in action? Whether you are exercising or not, whether you are lazy or active. I am talking just about skeletal muscle. Although you are right. He is perfectly right, but
Back.
the respiratory muscles.
The respiratory.
Even if we are sleeping, they are working. He is right about heart, but my topic is not heart. I am just discussing skeletal muscle. Heart starts beating when even our muscles are not formed. Heart starts beating when we are not in this shape. Just a few cells, subhanallah, Allah subhanahu wa ta'ala makes the circulation, and we have recorded 15 days old baby, just 15 days, and something doing like this, so that the fluids go into all the cells which are quickly dividing. So heart, agree. But here the topic is
Muscle.
this was the discussion of thick filament. Now we are in the thin filament. What is the actual name for thin filament?
Actin.
Actin. What are the properties of actin? This is just diagram. What is this place?
Head. No.
Binding site.
Binding site for what?
Thick filament.
Now I go back. Now I go back. You see, this is actin binding site. This binds with this one.
Yes.
What do you recall if you see this diagram? They are like the marbles, the glass marbles with which we play. The kids play. The glass marble. So it's not like a fiber, but they join together, and again, like DNA, two like this. My dears, You see, now I'm making it complex. If he likes him and wants to sit with him all the time, they will not study. They will always sitting like this, together.
Yeah, yes.
You understand? Not listening to us. So actin binding site and the actin's active site. If we leave them like this, the muscles will be always contraction.
Yes.
So Allah subhanahu wa ta'ala has made a system. You see, please don't mind.
Yes.
When I saw him laughing, I put him there. And he sat in between. You remember? The first 5-6 boys who were there, you remember my joke. You understand?
Yeah.
Now they cannot sit together. He is sitting in between. You agree?
Yeah.
Now Allah subhanahu wa ta'ala has made this system. I will jump few slides and then come back to this. This is called tropomyosin. Again, 2 fibers. And this is a protein which is made up of 3 proteins. This is called troponin. They bind together. I am jumping a few slides. Remember this structure. And remember my story. I don't want these 2 boys to sit together.
Okay.
I want to put something in between. You understand? Can you understand now? Or no? The troponin tropomyosin covers the binding site on the actin. Can the myosin head combine now?
No.
No. Why it cannot combine?
It's
Come
not.
on. Why it cannot combine?
They block it.
Why they two cannot meet? Please don't mind. Why they two cannot meet? Because he is in between. Agree?
Yes.
Are you with me?
Yes.
Please give concentration. Everything will be on the slide, but make the concept. You see, he is waiting to meet his friend. But in between, this is sandwich. What is the function of tropomyosin?
Tropomyosin.
Okay. Again.
Yes, I go back. That is why I say,
Take
don't worry. My question is about tropomyosin. What is the function of tropomyosin?
Covers
To cover the active site of
Active.
actin.
Why?
To not connect and stop.
So that the actin does not connect with the myosin. Why?
To not
So that it is not permanent contraction.
Okay.
Alright?
Yeah.
Are you ready for more story before reading this?
Yeah, go.
Yes.
Okay.
Now what happened is this. He likes both of them to be friends. Okay, leave him, I don't move him. So I am in place of him. He makes a trick. You see? I will give you something.
No.
And they meet. You understand what I'm saying?
Yes.
And he already said, what am I?
You are close.
I am calcium. You see, where did I start my story from? I started my, please don't mind, this is my bad habit, but I have to do it to give you concept. My story started from here. I said action potential comes, and when action potential comes, calcium is released. What is the function of calcium?
Contract.
Removing.
Take
Removing the tropomyosin, because he is blocking actin and myosin to meet. You understand?
Yes.
Now you will not forget it. It is there on the slides, and I'll go organized in an organized way. Now, when I brought him here, come with me, I will give you something. And he was looking back. As soon as he saw them that they have again joined, he ran back. So calcium, as soon as action potential is finished, it goes back here.
To the sac.
If calcium stays there, the contraction will not finish. Because I am taking him, come with me. I give you some chewing gum, some ice cream, some hadiya. They will be together. They will not go away till he reaches back on his seat. You understand? So now this is the concept of the contraction. If they meet, the Z lines come together. This is called muscle contraction. Okay.
Yes.
So my dears, we have got thin filaments which are actually actin, but on top of the actin we have got two other proteins which are called tropomyosin and troponin. Their function is to cover the active site of the actin. Same thing written over here. The thin filaments are made up of three proteins: actin, tropomyosin and troponin. Actin portion is composed of actin subunits which are twisted into a double helical chain. Each actin subunit has a specific binding site for myosin. It does not have for ATP. ATP function is function of the myosin. Okay. In a relaxed muscle fiber, actin is not able to bind with cross bridges because tropomyosin covers actin. This is what I discussed. He is sitting in between these two, actin and myosin. Okay, he is tropomyosin. Troponin stabilizes tropomyosin. What is the function of troponin? Troponin keeps it in place. You see, I will tell you very interesting thing, but this is not in your syllabus, just see it. So, this is the boy sitting behind you, and he holds him so that when they try to meet each other, he does not leave, You understand? His function is to hold him, support him. And calcium's main function starts from here, that I will go to him first and punch him so that he goes away, and I'll take tropomyosin away. So calcium basically binds with troponin. I said this is not in your course, but I am just mentioning it.
Yes.
Because easier will be this, that you understand who covers the active site? Tropomyosin. Right? Troponin is to stabilize it. Now what happens? So we have discussed all the topic. Maybe next 10 slides. We are now slowly passing through preparation of MCQs and things like this. Step number 1. Active site of actin is covered. Myosin is waiting. It cannot do anything. Number 2, nothing can be done. Number 3,
Calcium.
yes, let's read. Muscle fiber excited, released calcium, it binds with troponin, pulls troponin, the one sitting on the back. Yani my first task is to punch him, throw him away. So calcium binds with troponin, pulling troponin tropomyosin complex aside to expose the cross bridge, and the binding takes place. This is called excitation. Doctor, we don't know what you are saying. Okay, this is on the next slide. We'll do it once again and then I will write. Okay. So my dears, now we have many steps. Remember, I made them stand. They were Z lines. They had actin. My hands, they were myosin. This was myosin head. There was power stroke. This is called power stroke. I pulled them together. So the full story is now written over here. That is binding, power stroke, removal of the calcium and detachment, again binding. This is called muscle contraction, and now we make the concept by preparation for the exam. Okay. Now we have made the concept, we just read it. The contraction of a muscle cell occurs as the thin filaments slide past the stationary thick filaments. Action potential propagates from motor end plate, yani nerve, into sarcolemma, yani muscle membrane. That is why I gave you these names. And spread into sarcoplasmic reticulum. Now next what will happen? The calcium. So the action potential causes release of calcium. Next, what will happen? Calcium triggers contraction of muscle cells. Influx of calcium causes exposure of binding sites on the actin. This leads to binding of myosin to actin. This is what I demonstrated in front of you. The thin filaments are pulled inward, like I pulled both of them together. Overall, muscle shortens. What is muscle contraction? Shortening of the muscle. What is shortening? Z lines come close. Why Z lines come close? Because the actin active site is bound by the myosin active site. Why they bind? Because the calcium comes and remove the tropomyosin. You understand? Why the contraction ends?
Calcium.
Because the action potential finished and the calcium has to go back to its home, back in the lateral sac. When it goes back into the home, he gets up from his seat and he holds tropomyosin and bring him back on his seat. And the contraction is finished. This is called relaxation. So all these processes now in one place. Don't worry, read them when you are free. Step 1, step 2, step 3, step 4, 5, 6, till it is relaxed again. What is this? I will discuss in a minute, inshallah. What are these processes? This is nerve. This is called neuromuscular junction. Please, this is nerve joining with a muscle. This is called neuromuscular junction. How my brain can order my finger to do like this? Nerve, neurotransmitter, nerve, action potential, neurotransmitter, nerve, action potential reaches my muscle and releases calcium. And calcium binds with troponin and it removes tropomyosin and the active site is exposed and the myosin head binds with the actin. This is called muscle contraction. Now to make you relaxed, these steps we will discuss slowly. So what is the neuromuscular junction? It is junction between a motor neuron and the sarcoplasm of the muscle fiber. The motor end plate is the potent portion of the muscle cell membrane that is immediately under the axon terminal button. Yani, this is the motor end plate. This is terminal button. See, terminal button. Action potential arrives at the axon terminal. Release of acetylcholine. What is acetylcholine? Neurotransmitter. Remember acetylcholine. This is the first time I have used this word. Where is acetylcholine released? Acetylcholine is released here. Yes, neuromuscular junction. It's like synapse. Where is acetylcholine formed? In the presynaptic neuron. How is acetylcholine removed? By an enzyme called acetylcholinesterase. Alright? So every step is written here. Action potential arrives at axon terminal. It causes release of acetylcholine. Acetylcholine binds with receptor of the muscle, sarcolemma. It causes entry of the sodium. This causes generation of the action potential in the muscle. So all the steps are now written here. You know, when we are hand wrestling, if you put, for example, I and he, we are doing it. And he respects the teacher. He wants me to win. What will he do?
Use less muscle.
What did you say? Say again. This is my last message actually. Yes.
Use less muscle.
He says use less muscle. I will say use less muscle fibers. Yani subhanallah, Allah subhanahu wa ta'ala has given us this ability. This is jibilla, this is nature. That is, I can increase the number of muscle fibers which are involved. Different level of stimulation. Now you know why I taught you convergence and divergence? Yani, it's not like this that I am playing on WhatsApp and I am doing hand wrestling also. You understand? I have to concentrate. And he can relax it just to let me win. So, yani, one neuron and all the muscle fibers which it is supplying, this is called motor unit. I am giving you a new definition. The definition is motor unit. There are many motor units in one muscle. Some are small, some medium, some very big. So some nerves they supply 2. Some nerves they supply 10 muscle fibers. You understand?
Yeah.
Based upon this, see, I am now old. Let's take example of young boy. He can kick a football from here, inshallah, to break this wall with full force. And his very younger brother is standing there as keeper. He is just 5 years old. Will he hit with the same force? No. You understand? Not mine, it will hurt him. Yani, he can control the number of his motor units which are involved. How do you define motor unit?
Force.
How do you define motor unit? See here.
The motor is one motor.
How can we define motor unit? A motor unit is one motor neuron and the muscle fiber it innervates. I am trying to give you a concept that this is a big nerve coming from the spinal cord. It has many smaller nerve fibers. Each nerve fiber is supplying different number of muscle fibers. And we can involve more and more. If we need more force, what are the factors that increase force of contraction of a skeletal muscle? Why and how he made it less for me? And I took the advantage and I took it more. You know, so one,
Transmitters.
yani, how the muscle strength can be increased. Why did I say that, learn to focus? Why did I say that, I am playing a game here and I am doing hand wrestling? This is not the way. I have to concentrate here. You understand? So, it is the strength of the stimulus will increase by recruitment of more motor units. I hope this concept is now clear. I said, in a single given muscle, I can, please don't mind, I have to lift just this. I need less motor units. And I have to lift this. I need more motor units. And I have tried to lift this. I need maximum motor units. You understand? So this concept we make strength of stimulus and recruitment of motor units. If we cannot stimulate one muscle fiber, the motor neuron when stimulate will always stimulate the innervated muscle fibers, whether 2, 3 or 300. The motor unit act as one. What is motor unit? A motor unit is one motor neuron and the muscle fiber it supplies. You understand? What is coordination?
Coordination.
Coordination.
The range of motor units.
Coordination. When you were small, young in the Ibtidaiya, your teacher will make you say something after him or her. You say this thing. And you will all say together. And the sound will be like this. You understand? So this is power of the muscle. That is, we make coordination between multiple muscle fibers. This is motor unit and strength. Increased strength of stimulus increases force of contraction by recruitment of more muscle fibers. Why I taught you summation, spatial summation and temporal summation? Why I taught you divergence and convergence? So I am now bringing them back. Usually the smaller motor units have lower threshold and are excited earlier with relatively weaker stimuli. A motor neuron, just 2 muscle fibers. They are the first one to come to action. The bigger one wait. It's like an athlete, Ethiopian who runs 21 kilometer marathon. They keep on running like this, like they have not eaten any food and hungry, and when they come into the last 3 laps, they run like anything. Where do they bring their energy from? They involve their more motor units. This Allah subhanahu wa ta'ala has given us salahiyah. Bigger motor units are excited later. So this is the MCQ points. Smaller units, they are first to get excited. Bigger units, they are the last to get excited. Divergence, convergence, summation. Frequency of stimulus. Muhammad. This is what I discussed. Why I discussed it? For this. Frequent stimulation will increase force of contraction by summation of the contraction. +1 +1 +1 is +3. I am stimulating it more. The principle is that the first contraction, now understand this. If he keeps on sitting there, can they unite? Can the muscle contract without calcium?
No.
What will be the effect if calcium stays a little longer? Yani I keep him here for a little longer time.
Spasm?
The contraction will be more stronger. I said a little longer. A little longer.
Oh, good.
So repeated stimulation releases more calcium before the previous calcium has gone back to its home. You see, 1 action potential, 5 calcium released. Now they are going back. 2 has entered, 3 are out. Another action potential, 5 more come. Now 8 are there. Now no action potential. 3 are back. Another action potential comes. Now there are 10. You understand? So this principle is written here. It is the story of the calcium. That is, the principle is that the first contraction releases the calcium from the sarcoplasmic reticulum, which has calcium pumped to pump the calcium back. If the next stimulation comes very quickly, some residual calcium is already present. The amount of calcium released due to second stimulation increases the total amount of calcium and the contraction is stronger. Remember, read it. Remember,
The strength of contraction,
the strength of contraction
is
directly proportional
to the amount of calcium and
calcium which is there in the cytosol. If we repeatedly stimulate, the muscle will contract more powerfully because more calcium will be available. Our last 3 slides are disease. Sorry for my bad habit, but I have to do it to make you have a good concept. What is this? What is this?
The release of
What is this? Come on, I need full answer.
synapse.
Again, what is the name of this thing? Acetylcholine. My asking again and again means tell me more. Can muscle contraction take place without acetylcholine? Who gives the message of the brain to my muscle? Agreed. Calcium cannot, without calcium muscle cannot contract. But without acetylcholine, action potential will not be there. If the action potential will not be there, can calcium be released?
No.
No acetylcholine, no contraction. Low acetylcholine, yani less contraction. Listen, where is acetylcholine?
What?
See the diagram. Where is acetylcholine?
In the clefts? Or
He says in the cleft.
yeah.
Acetylcholine has to be here to cause contraction. It must be released from here. With what does the acetylcholine bind?
The head?
With the receptor
Receptor.
on the sarcolemma.
Sir.
Now listen carefully. If something destroys the receptors for acetylcholine, receptor, mustaqbil. If something destroys the receptor for acetylcholine, what will happen? There is
No activation.
There is no action potential.
Yeah.
So there is a disease in which our body starts eating our own body. Autoimmune disease. In which the antibodies go and they destroy the acetylcholine receptors in the muscle. What will be the result?
No action potential.
No muscle contraction. When there is no muscle contraction, tell me what will happen to me. He says shalal or paralyzed. What do you mean by shalal or paralyzed? How is it different from stroke or the brain blood vessel damage? These will be your main patients in physical therapy. Stroke or shalal, you know.
Yes.
The blood vessel rupture and on the other side the person goes shalal. What will happen to me if there is no acetylcholine receptor?
You can't move.
No muscle contraction, but what will happen? Can I stand?
No.
Listen, yes. Atrophy will be later, but first, no muscle contraction. But you are right. Before you came, we discussed this point, atrophy. Yes. Something else.
What?
Disability.
Disability means what? Very good. Cannot perform any motor function.
The muscle will be weak.
The muscle will be weak depending upon how much receptors are destroyed. Can I open my eyes?
If the receptors are there,
If the receptors are there, I can open it. The respiration is the last one to go. Otherwise, the person will die. But I become like a dead person. And where do you put the dead person?
coven.
In the cover or maqbara. What is the English for maqbara?
Graveyard.
Cover? Grave. You understand?
Yes.
What is the technical, pathological name for a muscle which becomes very weak? Or if we become weak? If I get very weak, this is called asthenia. So the word now which we are going to introduce and the disease to discuss the last point, 3 slides. When all these stories fail because the acetylcholine receptor is destroyed, the disease is called?
Myasthenia gravis.
What does asthenia mean?
Weak muscle.
Weakness. What does my mean? Muscle.
Muscle.
Myo. Myasthenia?
Weakness.
Weak muscles. How much weak? Yes. Like I have to be put into maqbara, cover. You understand?
Yes.
So it is so weak, like I am dead. What is the reason? Acetylcholine receptors are destroyed. Why they are destroyed?
Self.
Autoimmunity. I destroy my own thing. She cannot even open the eyes.
Yes.
So my dears, look at this. This is normal. Normal nerve transmission. Acetylcholine and these are the receptors. Now this is antibody against the receptor. It either eats or it binds with the receptor and blocks them.
Drug.
How will you treat it?
Remove the stopping the acetylcholine.
Acetylcholine. You see, it's not easy. He says remove the antibody. Not easy. Although we try by giving the steroids and many medicines, but still it's not easy. We have only one option. The option is this, that we put so much acetylcholine in this area that even if there is one receptor, it has always some acetylcholine available. But the problem, this acts only for few hours. Yani, today is this lady will say, today is marriage of my daughter. From 8 a.m. to 12. Okay? So we give her an injection and she is well at 8, a little less well at 9, more or less well at 11, and she has to be carried back home at 12 on stretcher. Or we give her another injection. You understand?
Yes.
Now we have tablets for different things. Anyway, now I will cover up this disease quickly. So, listen, may Allah keep everyone safe, but it is very common. Breathing difficulty, lung muscles, breathing muscles, difficulty to chew and swallow. Your muscles are not working, can you?
No.
You understand? Difficulty to climb stairs, lift objects. Yani, first signs, when the disease is not full like breathing difficulty, the person starts telling, I cannot walk properly, I cannot climb the stairs, and doctors cannot pick it up because there are so many reasons. Calcium can be less, water can be less, neurotransmitters can be less, 1,000 reasons for fatigue. Difficulty in talking, skeletal muscles. You understand? Even, for talking we need to touch our tongue to different places. The muscles move it, subhanAllah. Change in voice. You see, I'll show you her face once again. Facial paralysis. You see, I have got expression. I can do like this. I can be angry. My face has expression. This is called facial expression. Look at her face.
Empty.
It is like a dead person. Blank face. This is after treatment on the other side. So facial paralysis, fatigue, and finally the eyes close. These two, they are extreme. Breathing difficulty and the eyes close, like her. This is maximum.
Yes.
The problem is this, you see, jazbiya. If this muscle becomes weak,
It close.
the gravity or jazbiya will pull my eyelid like this. You understand? Wallahi, this needs energy to keep our eyes open. That is why when we are tired, our eyes are closing,
Yes. So, just-
Pathophysiology means what goes wrong. Pathology means ilmul amrad. Physiology means wazaiful a'dha. Pathophysiology means what disease makes the physiology wrong. What is the physiology? Acetylcholine. What is the physiology? Action potential. What is the physiology? Release of acetylcholine binding with the receptors. Releasing action, making action potential. What is the pathology? So autoimmune destruction of postsynaptic neuromuscular junction nicotinic acetylcholine receptors. Antibody binds and induces cell-mediated attack. Accelerated loss of these receptors. What is clinical manifestation? Weak proximal muscles, eyelids, and cranial nerves, and diaphragm, and extra optical muscles. These muscles of the eye.
What does manifestations means?
Manifestation means the things which are appearing as a part of disease.
So, symptoms. Or
Like, what is the manifestation of peptic ulcer? Pain, acidity.
yes.
What is the manifestation of shalal? The person cannot move the limb.
علامات.
أعراض يعني.
Yes,
Okay.
any presentation.
Hmm.
How to diagnose it? We have strangely one method to diagnose. We give injection of something which is like acetylcholinesterase inhibitor, yani the enzyme which finishes acetylcholine. We finish that enzyme. If we finish that enzyme, acetylcholine will increase. Why it will increase? Because the destructive enzyme for acetylcholine, it is destroyed. So this we give, and the person opens eyes. This is the proof that this person has got problem with acetylcholine. We cannot do much, I told you. Just they tell us, I have to go to bank, if I will sign the check, I can get money. So We give them medicine, they go to the bank, come back. May Allah keep everyone safe. Very bad we work with these things. So long-term acetylcholinesterase inhibitors, steroids, cytotoxic. We remove a gland from here, thymectomy, plasmapheresis. We have a professor here with us in Kuliyatik. His mother has got this problem. So we know a lot about this. We'll start from here, inshallah, next week.
What happened with him